Milo is here today for a dental procedure. This video diary will show you what happens during his stay with us. Firstly, his wait is recorded, then he and his owner take a seat in reception. After waiting patiently, they are called through to the consulting room. The nurse will go through the planned procedure and consent form and answer any questions. Milo is then transferred through to the dog ward and into his comfy kennel for the day. Like many of our patients having dental procedures, Milo is an older dog and it is recommended that we take a pre-anaesthetic blood profile. He is having a patch of fur shaved from his neck to provide access to the vein. It is prepared by cleaning and then local anaesthetic spray is applied to make the site numb before the blood sample is taken. The blood sample is immediately tested using our in-house laboratory so we can get the results within 20 minutes. We are checking Milo's kidney and liver enzymes as well as his protein and salt levels. His white and red blood cell count is also measured. This information detects any underlying health issues and guides the anaesthetic protocol. The nurses are taking Milo out of his kennel to have his pre-medication injection. This is a mixture of sedative and pain relief, which is given into the muscle. With lots of cuddles, Milo is certainly being very brave for his injection. A heat mat is put into the kennel to keep him warm as his pre-medication begins to work and he becomes sleepy. This is especially important for smaller dogs who can't control their body temperature when sedated. Milo is having his leg prepared for an intravenous catheter. This gives us access to his veins for his anaesthetic medication and in case he needs any supportive therapy during his procedure. The fur is shaved, then the skin cleaned and numbing spray applied before the catheter goes in. Once under anaesthetic, Milo's teeth are examined in detail and charted. A probe is used to check for lesions that indicate gum disease. We take photos of the teeth before and after cleaning as we know many dogs aren't keen on their owner looking in their mouth. The tartar is removed using dental forceps and then the teeth are cleaned using an ultrasonic scaler. It is very important to ensure the entire tooth, including under the gum, is completely clean. For safety and welfare of the patient, this can only be performed properly under general anaesthetic with a breathing tube in place. Only 1/3 of the tooth is visible above the gum line. We take x-rays to show the roots and full health of the tooth. The x-ray is taken and then immediately shows up on the screen so that the vet can make an assessment of any disease and which teeth need to be extracted. The diseased tooth is extracted using a specialised veterinary dental drill. The post-extraction x-ray is taken to be sure that the tooth and its roots have been removed in their entirety. This shows up on the screen and we can see that the roots are gone. The extraction site is then sutured closed. These stitches are dissolvable and shouldn't cause the dog too much irritation. The teeth are polished and then a final photo taken. Milo is gently awoken from his anaesthetic. A short time later, he's sitting up in his kennel and enjoying some dinner. The nurse will have a see-out appointment with you to go through the post-operative care information and give you the photos of what we've done today. And then it's time for Milo to go home. He is certainly happy to see his owner and his breath is a lot fresher for cuddles. Milo will come back in 5 days to see the nurse for a post-dental check.